10 early symptoms of diabetes. Not to ignore. Diabetes has certain symptoms that appear slowly. Know what the initial symptoms of diabetes are, detect them early, and get appropriate treatment. Diabetes is a disease that can sneak up quietly for years. Diabetes is a disease caused by an increase in glucose in the blood, either because the body does not produce enough insulin to correspond to it, or because the body has resistance to insulin. These signs appear slowly. It is also often confused with other illnesses. The problem is that when these signs are left alone, it prevents life-threatening organs such as the kidneys, heart, and brain from functioning normally. That's why it's important not to leave it as a common symptom, but to suspect that diabetes may be hidden. Today, in this video, I would like to introduce 10 early symptoms of diabetes that should not be ignored. Number 1. Feel tired. Lack of insulin or resistance to insulin can cause cells to be unable to absorb enough glucose for the body to function. This results in strong mental and physical fatigue. This fatigue will often last until the person rests. Excessive weight gain, obesity, lack of water, and unstable blood pressure are behind this condition. Number 2. Sleep disorders. Uncontrolled blood sugar levels in the blood can cause sleep problems and constant fatigue. Patients with type 2 diabetes have difficulty falling asleep. Similarly, people who sleep less than 6 hours a night are at increased risk of the disease. Number 3. Mouth thirst. Glucose is the main fuel of our body. However, if not used properly, it can be one of the causes of lack of water. Lack of water affects the activity of cells throughout the body. It affects saliva production and causes dry tongue and thirst. Number 4. Frequent urination. When glucose is in excess in the blood, the kidneys have to double their normal efforts to filter it, and as a result, you need to urinate more. This substance interferes with the normal filtering of toxins and interferes with the activity of the urinary system. Number 5. Urinary tract infection. Urinary tract infection is one of the early symptoms of diabetes. This happens because an increase in glucose in the blood weakens the immune system. As a result, antibody production is reduced and the body is recently exposed to attacks from viruses and fungi more. Number 6. The wound does not heal easily. The slow or no healing of wounds and skin ulcers is a clear sign that glucose is accumulated in the blood. Diabetics should also be aware of minor scratches on their skin. This is because it can lead to complex conditions that require treatment. Number 7. Foot trouble. The foot is the part where the signs of diabetes are likely to appear. This is because it causes circulatory system troubles, and fluid retention are likely to appear more on the feet. When diabetes goes out of control, it will suffer from nerve-ending damage. Number 8. Hazy visibility. The lack of water in the body caused by the accumulation of glucose can cause vision problems. Lack of water affects the lens of the eye and makes it difficult to focus. In other words, the field of the vision is blurred. Number 9. Food anxiety. If glucose does not get into the cells properly, it means that all organs in the body have less fuel to work properly. This condition causes confusion for the body, and it signals to get more energy sources through food. In other words, it is inevitable that you will repeatedly feel anxious about eating until you can control the accumulation of sugar. Number 10. Dry skin. It is also possible to suspect diabetes by observing the condition of the skin. The skin of diabetics tends to be dry. This is because circulation problems and lack of water are related. Of course, keep in mind that there are other signs as well. Other states may be hidden. Did you have a sign you could think of? Are you at risk of developing diabetes? If you have any concerns, please consult a doctor. Thank you for watching. Don't forget to like, comment, and subscribe. Comment